During the fight, a detail can go unnoticed by a lot of people. After an impact of the face, something changes. Posture, reaction, the dynamics of the fight. And this doesn't happen by accident. Sports medicine data shows that up to 40% of facial injuries in boxing involve the jaw, precisely because it takes direct force from punches to the chin. The problem is, the injury isn't always obvious at the moment of impact. In Jake Paul's case, information released after the fight points to significant jaw trauma, requiring imaging scans and surgical treatment. And when this happens to contact sport athletes, the entire approach changes. In today's video, I'm going to explain the injury Jake Paul suffered, how this type of facial blow occurs, what the recommended treatment is, and most importantly, what complications can arise, including those that impact a return to the sport. The chin shot and the biomechanics of a jaw injury. When people talk about a punch in boxing, many just imagine brute force. But from a medical standpoint, what really matters is how that force is transmitted. The chin acts as the kind of lever. When the impact comes from below or from the side, the energy is concentrated directly on the jaw. Studies in sports biomechanics show that punches to this area create a rotational effect on the head, increasing the stress on the jawbone and its joints. It's not just the direct impact that causes the injury, but the combination of acceleration, rotation, and sudden deceleration. That's why even without any visible cuts, there can be a significant facial injury. In Jake Paul's case, the impact pattern seen in the fight is consistent with this classic mechanism. The punch to the face didn't just stop his movement. It likely overloaded his jaw beyond its physiological limit. This type of trauma explains why an athlete often feels pain when talking, chewing, or closing their mouth, even when on the outside it doesn't look that serious. And that's exactly why after this type of impact, the next step isn't a matter of opinion. It's an imaging scan. What the CT scan reveals and why the teeth get involved. After a strong impact to the face, just looking isn't enough. For facial trauma in boxing, a proper evaluation starts with a CT scan of the face, because it shows what's happening with the bone, the joints, and their relationship to the teeth, all in detail. In Jake Paul's case, in addition to the jaw trauma, there were also reports of dental damage, which is relatively common with this type of impact. When the jaw is fractured or dislocated, the force can be transmitted directly to the teeth, causing avulsion, tooth fracture, or loss of support. This can happen even if the punch wasn't directly on the tooth. A facial CT scan allows us to identify the exact fracture line, if there's any displacement of the fragments, the alignment of the bite, and if there's involvement of the tooth roots or the bone that supports the teeth. And these details completely change the course of action. When there's an association with bone injury and dental damage, the treatment needs to be even more precise. Because re-establishing the correct bite is just as important as consolidating the bone. After the fight, one of the most talked about signs was that Jake Paul had a misaligned bite, which from a medical standpoint raises an immediate red flag. When a patient feels that their teeth no longer fit together the same way, it suggests a loss of the normal continuity of the jaw, usually associated with a fracture or bone displacement. Based on the pattern of the blow and the reports released, the fracture is consistent with involvement of the body of the mandible, or near the angle of the mandible, which are classic fracture areas in impact sports. This region is structurally critical because it receives the force of the impact and transmits it to the rest of the bone, in addition to being directly linked to dental alignment. And when there's displacement there, the bite changes immediately. Another important point is the involvement of the temporomandibular joint, the TMJ, even when the fracture doesn't directly cross the joint. The impact on the chin generates a brutal overload on the TMJ, which can cause joint inflammation, muscle spasms, and limited movement. It's common for the athlete to report pain when opening their mouth, clicking sounds, or a locking sensation. This combination of factors, fracture, bite misalignment, and TMJ overload, explains why Jake Paul's case isn't so simple. It's not just about setting the bone, but about restoring function, symmetry, and joint stability, something essential to avoid chronic pain, loss of performance, and future complications. When there's a mandibular fracture with misalignment, as in Jake Paul's case, conservative treatment is not enough. The standard procedure is an open reduction of the fracture with internal fixation, meaning surgery to reposition the bone and stabilize it with titanium plates and screws. This type of material is chosen because it's strong, biocompatible, and doesn't interfere with the athlete's daily life after consolidation. During the surgery, the main goal isn't just to close the fracture, but to re-establish the correct bite. And even before the final fixation, surgeons align the teeth to ensure that in the end, the jaw returns to its ideal anatomical position. If the bite is left incorrect, the athlete can develop chronic pain, joint wear, and loss of chewing strength. In the sports context, the stability offered by the plates is fundamental. It reduces the risk of fragment movement, accelerates bone consolidation, and allows for a more predictable rehabilitation, something essential for anyone who intends to return to professional boxing. And in many cases, these plates remain in place permanently with no need for removal. Before we continue, leave a like and subscribe to the channel. This really helps the video reach its destination, more people, and allows me to continue bringing medical analyses of everyday content, rehabilitation, recovery, and risks of complications. After surgery with titanium plates, the most neglected phase begins, rehabilitation. The first few weeks, the priority is to ensure that the bone heals, without incurring new charges. This involves strict pain management, reducing swelling and, mainly, functional restriction of the mandible with a liquid or semi-solid tie, in addition to limiting a wide range of movements. Between the second and sixth week, the focus shifts to progressive functional recovery. This is the stage where controlled exercises come in. Physiotherapy, orofacial and close monitoring of the joint, mandibular tempo. And what if this step is poorly handled? The risk is not that the fracture will reopen, thus evolving with rigidity, chronic pain, or permanent bite alteration. And potential complications in these cases are not uncommon and need to be taken seriously. They include persistent pain in the TMJ, limitation of mouth opening, loss of sensation in the lip or chin, premature joint wear, and difficulty returning to high-impact sports in athletes like Jake Paul. Any one of these changes. This could mean a drop in performance or a delay. Important, upon returning to training and fights, 3. Return to the sport. When is it safe to fight again? In the case of a jaw fracture, treated with titanium plates, time itself, it is not the main criterion for returning to sport. What really matters is the function, bite stability, absence of significant gain, and good joint mobility, mandibular temping. Without that, the risk of a new injury increases significantly, even with bone already healed. In general, athletes begin light physical activities after a few weeks, but training with impacts to the face require much more caution before allowing a return to contact. It is essential to confirm whether the jaw can support the load, that the TMJ is stable, and there is no pain when pressing, to speak or open the mouth forcefully. In many cases, new imaging tests, they help to confirm that the consolidation occurred in a way expected. In professional boxing, returning early can have serious consequences. A new impact in the same region can lead to a more complex fracture, displacement of the plates, or worsening of the joint. This leads to the risk of permanent disability. For that very reason, experienced athletes need to respect the time, biological recovery, because in the ring, there's no such thing as half strength. The case of Jake Paul shows that a blow to the face, it can cause a serious injury, require surgery, and completely change the athlete's recovery. Now, I want to know from you. Comment below if you think he'll come back at the same level as before. And don't forget to leave a like and subscribe to the channel so I can continue bringing more medical analyses of our daily lives. And if you want to help even more, the channel has an Amazon affiliate link in the description.